Well, now a worrying development being reported in Mumbai. Doctors from the KEM Hospital have observed a worrying trend of cured COVID patients returning a month or so after their discharge with a pulmonary fibrosis, a severe scarring of tissues in the lungs that causes shortness of breath, requiring oxygen support for long durations, and in some cases for the rest of the life. KEM is treating 22 such cases currently, and it's not just being reported in Mumbai. In fact, in China as well, 90% of a certain sample group of COVID recovered patients from a prominent hospital in China's Wuhan city, where the pandemic broke out, have reported lung damage. This was reported by state-run Global Times. A team at the Zhongnan Hospital of Wuhan University has conducted follow-up visits with 100 patients since April, and according to the first phase results, 90% of the patients' lungs are still in a damaged state. Well, to talk more about this, we're now joined by Dr. Hemant Deshmukh, Dean of the KEM Hospital from Mumbai. Thank you so much, Doctor, for sparing your time and speaking to us about this. First, tell us about what has your experience been with these patients who are returning with this lung condition.
Most of these patients who had developed lung fibrosis, we could actually diagnose these conditions quite early. And just because we diagnose this condition quite early, none of the patients would progress to a long disease, a morbid disease in general. But these patients with pulmonary fibrosis, we really thought that they would require more oxygen, and they have significant hypoxemia because of the lung fibrosis. Now, these patients with lung fibrosis have come back in the sense that when they were discharged, they were actually cured of the COVID disease. But gradually we realized that these patients needed some kind of clinical follow-up. And when our team of doctors, the psychiatry team of doctors, actually telephoned them about their well-being at home, they realized that they were still breathless, and we advised them to come back and get admitted at the hospital so that we can really evaluate them whether they really have lung fibrosis or no.
Right, and doctor, was this among a particular age group? Was this seen more among the elderly? If you could, share that with us.
There's no particular age incidence amongst these patients, but probably they had some kind of previous lung injury or lung disease wherein the lung fibrosis had already set up. And these patients were actually all treated in the intensive care units of the hospital when they were admitted for COVID cure.
And you feel now there needs to be a more extensive study to understand this. Is it because of COVID that their lungs were damaged? You're saying some of them had a previous condition. Is it also because of the kind of treatment? We know there are a lot of different drugs that have been used, from steroids to remdesivir, to all sorts of drugs that doctors have been using.
By and large, whatever the treatment for COVID was instituted to these patients, none of them actually induced lung fibrosis. But we realized that these patients did not have any kind of major pulmonary disease in the past. And these patients with pulmonary fibrosis, to actually stop the progression of the disease, we have instituted some kind of definitive therapy in these patients in the form of medications. And in some patients, we have instituted some kind of oxygen concentrators at home.
All right. And so, doctor, again, coming back to the point, do you think there needs to be a wider study on this? It's interesting to see that a similar, thing is being reported in Wuhan in China, where they're also doing these follow-up checks on patients, and they're also finding lung damage among those patients.
Yeah, when we realized that Wuhan also had similar kind of affliction of the lung parenchyma, we thought that over a long period of time, say at the end of 3 months following discharge, we should be getting the high resolution CT scan chest of these patients done, so that we recognize the disease much earlier and stop the entire progression of lung fibrosis, so that this doesn't become a more debilitating disease in the future of these patients.